Hello, and today I am going to be telling you about the Affordable Care Act and in particular how tobacco users are going to be affected by the policy changes that are happening and how it's going to either impact them for the negative or the positive. I'm going to begin by covering some of the statistics about smokers currently and then mention maybe why the ACA would want to be implementing these changes. The Affordable Care Act is actively targeting the population of smokers in its quest for better health care. This has to do with the fact that under the Affordable Care Act, preventative health is becoming a bigger issue, and smoking is a preventative health concern, considering it's something that you can stop and choose to stop and actively want to stop in order to better yourself. Cigarette smoking has been identified as the most important source of preventable morbidity, illness and disease, and premature mortality, death, worldwide. Smoking-related diseases claim an estimated 443,000 American lives each year, including those affected indirectly, such as babies born prematurely due to prenatal maternal smoking and victims of secondhand exposure to tobacco's carcinogens. Smokers also die significantly earlier than non-smokers. 13.2 years for men and 14.5 years for women. Cigarette smoke contains over 4,800 chemicals, 69 that are known to cause cancer. Smoking is also a major factor in a variety of other conditions and disorders, including slow healing of wounds, infertility, and peptic ulcer disease, all things that are currently being treated as preventable diseases. According to the Centers for Disease Control and Prevention, neonatal health care costs attributable to maternal smoking in the U.S. have been estimated at $366 million per year, or $704 million per maternal smoker. These increased costs are one of the reasons why the ACA is focusing on trying to limit the amount of tobacco users and therefore limit the cost of healthcare being spent. Also, according to the U.S. Department of Health and Human Services, tobacco advertising plays an important role in encouraging young people to begin a lifetime addiction to smoking before they are old enough to fully understand its long-term health risks. This brings up the fact that the ACA is looking to try to limit the amount of tobacco users by actively attacking the problem at an earlier age when children are more inclined to be smoking. Secondhand smoke also causes an increased health risk for many people in our population. Secondhand smoke, involuntary inhaled by non-smokers from other people's cigarettes, is classified by the U.S. Environmental Protection Agency as a known human carcinogen, responsible for approximately 3,400 lung cancer deaths and 46,000 heart disease deaths in adult non-smokers annually in the United States. Smoking through parents is associated with a wide range of adverse effects in their children. Parents that smoke that have children, their children often have asthma, increased frequency of colds and ear infections, and sudden infant death syndrome. Secondhand smoke causes more than an estimated 202,000 episodes of asthma, 790,000 physician visits for ear infections, and 430 sudden infant death syndromes each year. These increased health care issues that need to be addressed by physicians increase the cost of health care over time. Another reason that the ACA is trying to target tobacco users and decrease costs. One of the ways the ACA and the government is trying to limit the use of cigarettes and tobacco is with the cigarette tax. By raising the cigarette tax, it reduces the use of tobacco. For every 10% increase in cigarette price, it reduces youth smoking by about 7% and total cigarette consumption for about 4%. Another benefit of the cigarette tax is that it increases the revenue in the United States budget. In addition to cigarette tax, the ACA is trying to help people who want to smoke quit smoking by implementing smoking cessation programs. Under the ACA, health insurance exchanges will be required to provide some sort of smoking cessation program. However, these programs will vary from state to state and with each insurance plan. Considering 33% of individuals on Medicaid are smokers, expanding smoking cessation medications under the Affordable Care Act could actually help decrease the cost of health care over a period of time. Also, under Medicare, the annual wellness visit has been added, which allows for better connection to patients for cessation services, as well as covering 8 cessation counseling sessions per year, along with any prescription medications needed to fulfill the cessation requirements. Lastly, a way in which the ACA is combating tobacco users is with increased insurance premiums. Insurance companies under the ACA will have the ability to charge more for tobacco users and smokers in regards to premiums. States will have the ability to choose whether or not they want to increase premiums in health exchanges, which could be as high as 50% for smokers. According to USA Today, smokers who have chronic diseases will not be affected by the changes in the insurance premiums. This is due to the fact that insurance companies are being mandated to no longer charge increased prices for premiums for individuals who have chronic diseases. So today I have talked about the ACA and in particular how the new policies at the ACA will affect tobacco users. I have also covered why it'll affect tobacco users and that smoking is the #1 preventable cause of death in the world. I have covered how cigarette taxes will be increasing for tobacco use and for cigarettes, and also how the ACA is implementing new smoking cessation programs for those Americans who do want to and strive to quit smoking. Additionally, I covered how insurance premiums are going to increase for tobacco users and how these will all be motivators for people who want to quit smoking and will also help decrease the cost of healthcare in the United States future. Thank you for listening to our brief, and hopefully you have been informed a little bit more on how the ACA affects tobacco users.